In 1947, low-ranking soldiers in Guatemala were used in disease experiments. The surviving records contain no evidence they agreed. This was not a secret CIA program. It was US-supported public health research, and it kept expanding. Researchers were trying to solve a real problem. Sexually transmitted infections were damaging military readiness. They wanted treatments and prevention. But in Guatemala, a medical project crossed a line. Some research deliberately exposed people to syphilis, gonorrhea, and chancroid without their consent. Independent ethics analysis describes testing, exposure, and specimen use without informed consent, often with active deceit. The question is not why doctors wanted to prevent disease. The question is why prevention turned into using people as exposure material. John Cutler led the Guatemala work. Behind him was a system, the US Public Health Service, its Venereal Disease Research Laboratory, the Pan-American Sanitary Bureau, and Guatemalan institutions that provided staff, facilities, and access. The laboratory was built in Guatemala City. The network reached army installations, hospitals, psychiatric institutions, public health clinics, and the penitentiary system. That access mattered. It gave researchers controlled populations, people whose movement, medical care, and daily lives were already governed by someone else. The original plan was to test a preventative wash on prisoners after sexual exposure to infected commercial sex workers. Researchers hoped Guatemala could provide conditions they could not create at home. But infection proved difficult to induce. The work expanded across institutions, diseases, and procedures. From February 1947 through October 1948, Cutler later reported 32 gonorrhea experiments, 17 syphilis experiments, and 1 chancroid experiment. Most intentional exposure work happened in the Guatemalan army. Many subjects were low-ranking soldiers. The commission found no evidence the soldiers consented. In the psychiatric hospital, researchers worked with all 3 diseases. In the penitentiary, intentional exposure was limited to syphilis. The records also show commercial sex workers used as part of transmission experiments. The commission found no record that the women consented to take part or new researchers had infected them. That is the point where this stops being a story about a bad medical decision. It becomes a story about a system that could make people disappear into categories: soldier, prisoner, patient, sex worker. Once they were categories, somebody else could decide what risk they should carry. The commission counted 1,308 people in intentional exposure experiments. It documented some form of treatment for 678. Those figures do not settle every outcome. They show why this story cannot be cleaned up with one number. The records are detailed enough to prove deliberate exposure. They are incomplete enough to deny us a neat ending. And Guatemala was not Tuskegee. The Tuskegee study observed men who already had syphilis and withheld treatment after it became available. CDC says those men were not purposefully infected. Guatemala involved deliberate exposure. Both were abuses, but calling them identical hides what made Guatemala distinct. The record carries another danger. Cutler's papers noted 83 deaths during the years of the experiments, but the commission said the exact relationship between those deaths and the procedures was unclear. So no honest documentary should turn 83 deaths into a claim it cannot prove. The documented horror is already enough. People were deliberately exposed without consent. For decades, much of that evidence remained in Cutler's papers. He had donated them to the University of Pittsburgh. In 2003, historian Susan Reverby found them. Her later disclosure triggered government review, and the records eventually moved to the National Archives. In 2010, President Obama expressed deep regret and apologized to those affected. An apology answered one question. The United States admitted this happened. It did not answer the harder one. How did it become normal enough to fund, staff, and document? Not because one person woke up and decided ethics did not matter, because every part of the system could see only its own task. A laboratory saw a procedure. A military office saw readiness. A hospital saw patients. A government saw facilities. And the people inside those institutions became the last thing anyone needed to ask. The files preserved dates, methods, and numbers. What they could not show was permission. That absence is the real record of Guatemala.